colon, please don't forget the scope guide. It drives them absolutely mental. They've also had 3 scopes go out in the last 12 months that have been damaged. So please, when you're handling the scope, try to be very gentle. The first thing you're gonna do is line up dot to dot on your machine and plug it in. It only goes in one way, so you really can't screw it up. And you're gonna put all your bits on. They're the exact same as the old scopes. The colors match up to set them up. If this valve ends up leaking, there is disposable ones in the drawer. Once you hook up, it comes up on here. In here, we don't have to put in a whole name of patients, so you can just enter new patient. When you fill in the patient ID, if you don't fill in the patient ID, your pictures will not print, which is super annoying, and I won't say that part. So we put G for gastro, C for colon, D for double, whatever you guys want to write in there is fine, as long as something's in there. And then your patient name, you can just write whatever you want there. The other important thing about this screen before you start is who your surgeon is, your presets. Each surgeon has their own preset. If you don't put their presets in, the buttons are not the same on the scope for them. So it's really important that you choose who you're working with and load their presets. Once you're doing, this is a gastro, so you're not gonna have your PIP on here, but if you're doing a colon, you're gonna make sure your PIP is on. So that stands for picture in picture. That's when your scope guide is gonna show up on your screen. Super important to have that up before you start the scope, or else it will not hook up properly. The other thing that turns on the screen when you plug your scope in is all this information here. If I turn the PIP off, you can see everything to do with that similar scope. So you can see that there's no USB plugged in, no pictures have been taken. If you keep going down, it tells you the scope number. It tells you the size of the channel of the scope that you have in there, the inner and outer diameter of the scope, and all the button preferences. So if your surgeon can't figure out which button is which, you could do that for like a locum or something. The important part about the channel number is that that determines what you can stick down your scope. So if you have, say you have a slimline colon scope, your channel will be smaller than the large biopsy forceps. So most of the surgeons know that already, but that will say 2.8 and your large thing is 3.2. So it will not fit down there. The other important thing about your PIP is when they're starting their scope, so they're about to put it in the patient, you need to hit the scope position button, which is right here, lit up. That is what hooks this up to the scope guide. So if you don't do that, your numbers will not be right. The other important thing about the scope guide is how you line it up. So if the patient's on their side, this bottom edge needs to line up with the bottom of their bum. Or else, again, it will not hook up properly. Your picture-in-picture will come up here as the scope moves along. Gray is good, green is searching. It won't show you now because it's not on there, but when it goes green, it just means that it's searching for the scope. It doesn't mean that you have to do anything about it. It just means that it's not a super accurate picture. It still works just fine. Jeb was saying that when you're rotating the patient, so say you're moving the scope in, you're getting a loop, they ask you to put the patient on their back, you can rotate how your picture-in-picture is. So if you look on the screen at that little mannequin, the blue arrow is showing you that that part of the patient's body is towards the scope. If you hit the rotate button, that's prone. Rotate, that's facing away from the screen, and that's patient laying supine. You can rotate both ways, so if they just go one direction or the other, you can rotate it, and that just make sure that your scope guide is hooked up with how the patient is positioned. What else could I tell you? Does everybody know how to test a scope?
No.
Are you serious?
Yeah.
Okay, sorry. I'll rewind. I'm just gonna use this old tubing that's already set up because I'm not wasting tubing, but every time you set up a scope, you need a bottle of water, you need a set of irrigation tubing, one of these, which is not disposable, please don't throw them out, and a suction tubing. The new rules now is that each scope or each patient needs to have their own suction tubing. Throw it out every time, get a new one. Each patient also needs one of these little adapters on the scope. So there's only one place for it to thread on. When you set up your scope, just add that to your little button pieces and put it on. Once you've threaded this through, just like the old way, there's only one way to put it, so it's going towards the scope. You just thread that on there. This has a big and a small. You're gonna set it up big to small. And your suction is gonna go on the Christmas tree. This is the same for every single scope except for the really thin pediatric scopes that we have don't have a foot pedal. So it will not have this blue thing. You have to shoot water right through the port. It does not have enough room. Yeah, it does not have enough room in the scope channel to have that. So to clean it and to spray anything in the patient, you have to go right through the port. Oh. Thank you. This is your gas. You need to make sure that it's on when you're testing. This is your foot pedal, which turns on here. So when you first set up, it's orange. You turn it on for the day and you turn it up to 5. It's just average looking. I don't have any water in here. Sometimes if you have problems with gas, it just means that your bottle is screwed on wrong. It happened the other day in here where Travis wasn't getting any gas. So just try taking the lid off, turning it back on, checking all your connections to make sure that it's all fitted properly. The testoscope, you're just gonna use your buttons. So you're gonna stop, you're gonna cover the button and make sure that bubbles show up. That's your gas. And you're gonna push it down and make sure that air comes, or that water comes out. That's your windshield wiper. If it's not coming out, which it's not right now, it just means that your clamps are closed. So you wait for the windshield wiper to work. Lots of times over there, when you're switching scopes 100 times, you get airlocked. So if you're trying to push down and it's not working, just move on to the next step and go back and it'll usually let itself go. And then the last step is to check your foot pedal. So you want water to come right out of there. And then your scope is ready to go. So the scope has kind of its favorite way to lay. That's part of the scope handling, that you need to kind of make sure that you're being really gentle with it and not twisting it all around. We always set it up this to the left because all of our surgeons are right-handed, so that's how they pick it up and set it on the patient. What else could I tell you? I guess we can go, does everyone know how to clean a scope?
No.
The one question, can we hang scope with the handle over
You
there?
can hang the scope up there. I never do, but that is what it's for. So you're more than welcome to hang a scope up. To clean the scope once you're done, so once the patient's done, usually the guys will put their scope in the garbage can. If they don't, feel free, because it's just the easiest, most protected way to clean your scope. You leave everything on the way that it is. You just take wet gauze, you wipe your whole scope down, make sure that there's no visible stuff on there. Once you do that, I recommend changing the button now, because once you change the button, this thing starts to spray water, and it's shitty water. So if you take out your blue button, you put in your key, That makes the 2 channels 1 channel, so it's easier to clean. And then basically you go through the exact same steps as you do to test. So you suck for 10 seconds, and then you suck air for 10 seconds. That pushes all the fluid through the scope. Then you're gonna cover for 10 seconds. Then you're gonna push down for 10 seconds. And then you're gonna pedal for 10 seconds. After that, your scope is clean as long as your water that's running through it is clean. I usually put it back in the garbage to do this because I don't wanna hold it, but you're gonna end your exam here. This is if you're doing only 1 scope, you're gonna end your exam. So basically, if you're ending your exam, you're done with that patient. If you're not done with this patient and you're just cleaning a gastroscope to go to a colon, you're just gonna disconnect your scope. If you're done with the patient, you're gonna end exam, hit yes, wait, and then disconnect scope and yes, and wait again. You try not to disconnect your scope until it says that. You need to close your caps and turn your gas off before you disconnect, or else you will have a shower. When I take them off over there, I tend to just leave this on the scope because I can't remember if they need it for cleaning or not, so I just leave it with the scope. And then if they don't need it for cleaning, they can take it off. This just wiggles off, just be gentle with it. And then you can unplug your scope and everything is done for that patient. The only thing else I forgot to mention is that you don't need to white balance these scopes anymore. Unless they go out for repair, they get white balanced one time and then they don't need to be touched again, which is super nice. I don't know what else everybody wants to know about setup and take